My name is Becca, and I'm a student at Webster University in the nurse anesthesia program. We'll be coming to Cameroon to meet you guys, and we're here to talk to you today about the video laryngoscope 3D printed blades that we'll be bringing to you. This is the exact model that we will be bringing, along with a camera that we'll talk about how to assemble later. These cameras are compatible with most smartphone devices, whether you've got a USB-C, a lightning cable port, or a micro USB. We have all the adapters for whatever device you may need. The way the cameras work and the way the image will pull up on the video laryngoscope is with an iCamera app. Each of the cameras that we will be bringing have a QR code to scan that will prompt you to download the app. If you don't scan the QR code, the first time you plug the camera into your smartphone device, your smartphone should prompt you from whatever app store, Google Play Store you may use to download the app at that point. There should be multiple stops for you to get the app from wherever. So assembly for the camera. First step is you're going to take off, there's a little camera cover at the end. You're going to unscrew that just like so. It's just a small little circle. You're just going to set it aside, but you will want to keep note of where it's at because we will use it in just a second, okay? Then next, our blades have a hole at the very end here. You're going to slide this camera all the way through and give yourself some slack here. The next step, you'll take the end of the camera through the end of the laryngoscope blade, okay? Once that camera's through, you're gonna flip it around and you'll see a little tab here. You're just gonna tuck the cord in so that you're not messing around with too much cord. At this point, you're gonna wanna reattach that camera cover that we just removed, okay? And you're gonna screw it on. This piece of the camera is very important, so you can't lose it because it protects the actual camera from any juices you may encounter, saliva, bleeding, blood, vomit, anything like that. And so it just protects the integrity of the camera. So then once that camera cover is reattached, you're just gonna pull it back through so that the entire camera fits snugly into the end of the laryngoscope blade. There's nothing poking out, okay? At this point, you're set up and you're ready to go to plug into a smartphone device to intubate your patient with video laryngoscope. At this point, we're gonna run through a demonstration on how exactly that will look on a smartphone device from a first-person view, so you know kind of what you're looking for and what it should look like. Okay, so we're gonna be running through a real-life demonstration on how to intubate a patient with these video laryngoscope blades that we'll be bringing to Cameroon with us. So we just got done assembling our blade with the camera and everything. We've got our smartphone device set up and ready in an easily visible place so that we can see the image when it pulls up once we have our view, okay? So first thing we're gonna wanna do is we're gonna wanna take our blade and the cord and we're gonna wanna insert it into our smartphone device. As you can see, I don't have the app pulled up currently, but it will prompt me since I already have the app to open it up, and now you can see whatever my camera is seeing. So there you can see from the end of the laryngoscope blade, the view on the camera. One thing about the view you're gonna wanna note is that there should be a gray part of that is part of the blade. You're gonna want that to be in the top left corner. If it's not when you initially plug it in, there's a little rotate where you can rotate the camera, and you'll just rotate it and rotate it and rotate it until that gray piece is right in the top left-hand corner, okay? Okay. Now that we've got everything ready and set up, we're gonna go ahead and intubate our patient. So we're gonna scissor the mouth, insert the blade, okay? At this point, I'm making sure I'm not hitting any teeth and I'm getting the blade in there well within our range. At this point, the image is kind of dark. These cameras all have a brightening or dimming aspect to them, where we can make the camera lighter or brighter. So I'm just going to go ahead and turn the brightness up on that camera. I'm going to go ahead and keep inserting my blade to get past the tongue. At this point, I see the epiglottis, and I'm now focusing purely on the image in my screen. Okay, I've got the cords in view, and I have our tube ready for when we started. Okay, I'm going to go ahead and insert the tube into the patient's mouth, just making sure I'm not going to hit anything. And I'm waiting for this to pop up on the screen just like that, okay? So at this point, I have full view of the vocal cords, and I'm just watching my screen as I'm inserting my ET tube through the cords. At this point, the tube is in, and I can visually see that it has been placed correctly and where the location is at. So I'm gonna go ahead and inflate my balloon, gently take out my video laryngoscope blade, and our patient is now intubated. Okay, now that we've run through assembly and had a live in-person demonstration with the first-person view, we're going to talk about a little bit about just odds and ends, care, and cleaning afterwards, okay? So one thing to note that we will also be bringing with us to Cameroon is these video laryngoscope blades require kind of a special stylet. These stylets we will be bringing are also 3D printed, and they have a bit of a steep angle at the very end. They are flexible enough to get you where you need to be, but they are rigid enough to kind of hold their shape once inserted into the ET tube. This will help you get around that hard angle that we're kind of bypassing with the video laryngoscope, okay? So then after you've intubated your patient, you kind of want to move on, use this blade on the next patient. The only thing you're going to want to do is you're going to take out the camera. So kind of do the opposite steps of what we did before, is you'll take off the end of this camera cover here, and you'll just wipe down the camera. Make sure you just got it clean. There's no remnants of anything on there. You'll take it out just like that, and then you'll take your blade and you'll soak it in hydrogen peroxide for about 10 minutes between each patient use, and then you should be good to go. I hope you have enjoyed this presentation, and I wish you all the best of luck, and I hope you're excited about video laryngoscope because it's pretty cool.